What up, fellas? It's Ty. Welcome back to the channel. We discuss all things prostate and prostate cancer related. If you're new here, welcome to you. If you have already been here, watched the video, even liked and subscribed, I appreciate you and welcome back. So today we're going to talk about something that I found was a hole in the process when I was going through my prostate cancer recovery. And that is, everybody understood what I needed to do for my prostate cancer, but I was handed a pamphlet with the information on it to recover my sexual functions and to figure out how I was going to get my penis and everything back to where it is that I wanted it to be. I went and they had a doctor. I went to talk to the doctor, but nothing came of that. It was a really weird meeting because I didn't leave there with a firm understanding of what it is that I needed to do. I'm like, look, whatever it is you tell me to do, I'll do. But you gotta tell me the path. I didn't leave there with that. So I'm gonna give you this information. It's uncomfortable for me to share. Even more uncomfortable for you all to listen to it from me. Even if you swipe away, if you have had the radical prostatectomy, or if you're about to have it, you need to listen all the way through. So, if you've had erectile dysfunction or maybe an enlarged prostate, and then later on you got diagnosed with prostate cancer and later had the radical prostatectomy, if you sit and think about it for just a minute, you may realize that it's been a long time since you've consistently used your penis. And so, what may be happening is atrophy may be setting in. Now, atrophy means kind of wasting away, right? It's the old fancy $2 word for use it or lose it. So basically, what we're saying is, go to the gym, you work out, your t-shirt's real swole up on you, and then all of a sudden you take a couple months off, and all of a sudden that t-shirt's a little baggy because your muscles aren't stimulated with blood. Well, that's the same thing that's going on with your penis. And what I don't want you all to end up doing is waiting for it to heal before you start to stimulate it. What I did was, as soon as the doctor cleared me and the catheter was out, you immediately have to start on a course of stimulating your penis. It is a muscle. So you immediately start figuring out how you're going to get that done. Whether you're going to be looking at porn to do something, but you need to make sure that you are reminding your body as you heal that you plan to use that. Yeah, look, I want that to come back, man. Because if you don't, it's going to heal. And I was talking to my doctor about it, and I said, hey, he said, look, if you're not using that, the blood flow that's going in there may go somewhere else. Now, I'm paraphrasing, of course, but basically it's, if you are not using that area, then your body's like, well, why are we sending blood flow that way? And once you heal and your body thinks that, it's hard to reprogram it, I'm sure. So, start with the process. You can manually stimulate. You can get some assistance from your significant other. Those things will work. You also can get a penis pump. Now, they have a couple of different kinds, but, there's a manual one, and then there's an electric one. Both of them have the same type of suction. I will tell you that if you are going to get a penis pump, get a real penis pump. Don't go to your local store and pay $15 and get you a penis pump. Don't do it. Listen, if you were in the cars, you'd get the best car. If you were in the golf, you would get the best golf clubs. If you was in the bowling, you get the best bowling ball. Why the hell would you go in there and spend and be cheap on your penis pump? That's ridiculous. Some of you don't have it that way or whatever. You can look at the reviews and get the best one. But which one you can afford, that's how you're gonna get yourself back together in working this thing out. Now again, once you start that, you may get to the point of orgasm. You need to be ready for that. Because if nobody told you, you're going to have a dry orgasm. Well, what does that mean, Ty? Nothing's coming out. It's going to feel the same. The absolute same. The process, everything. But nothing's coming out. Now, there is a significant portion of you who are going to have something coming out. And it's going to be urine. And it's going to be weird because that's part of your incontinence. So some of you may have urine coming out. I forgot what that's called. I'm not a medical professional, but I did look up what it was called. And so that could be happening, but you need to know that that's what your circumstance is. You're going to go through a lot of processes, guys. Your penis may get hard at the tip and then or at the bottom, but the tip is not enough for you to put it in, right? So you got to work through this whole thing. And again, it's going to take some time, but just like your body, when you start working out, you don't see all the results right away, but eventually, you start to see the results in your shirts. And that's the same thing that's going on with your penis, but you start that process early. And when I'm talking about stimulating, I'm talking about at least a couple times a day. Like pull the penis pump out in the morning and at night. I mean, because you're probably not in the circumstance where you may or may not be in a place where you could actually have sex. And if you are having sex, if you're in a good place, that's awesome. But if you're not, maybe you're not hard enough to get in and actually have sex, or maybe when you're even having sex, you can't even go that long. So you need to keep practicing. Yes, I know. It's difficult. Hit the button, but come back. So again, you can watch porn, but you will get tired of it. But again, who cares? When you're going to work out, you get tired of it. But you have to. So, get to work. Really, man, get to work. I know it seems funny, but a couple of times a day, go back to when you were 16, 15, 12, 10, whatever it was. You need to stimulate your penis and remind your body that you want to use that muscle. It's going to help in the back end. It will also probably help you, like it helped me, because if you decide you want to take the pills, it will actually make it so that you're good to go. So, I hope this helps you. But who cares that you had to buy that? Who cares that you have to do that? Who cares? At the end of the day, erectile dysfunction will jack up your mental health. You don't need that. You just don't need it. Again, you need to make sure that you're getting this done. I hope this finds you well, fellas. Peace and blessings, man.